eba be kidney infection na ehu say oh say na eba no anase say na kokofa bae saa nkomo no na yebo ye started with urinary tract infection ye hwe bladder infection ye hwe mema na ye hwe prostate and na last week so ye hwe emba na ye hwe be a friend pelvic inflammatory disease nkomo boni nyina no one thing na yebo so no infections and then ye baba betua ye nkomo bono so and then ye baba behwe bibi apoto kasem ye kan reoccurring infections anampo no se bia wanya infection bi na ekọ na onum eduro na ekọ ye o ho na asan so aba eba as nipa no den na so wo ye den ekọ ma yare ni san so po eba abiem na na mombe na so wutu you know sometimes the yarn ekoba ko afi bedu bi no onum eduro na enye adwuma biem na obi say eba ni say afi obehu na you are tend to overdose the medication and I say you are tend to drink more than enough of that particular medication bo na afi akwakofa kidney yare na de aba because you have done something, you have overdosed your medication, it has affected. So when I will be can and herbal medicine there, onuma na say kidney enye herbal medicine no, e wo dosage no. E say na wo nom no and e kofa by. And the san common near babo you wia na ya ma wa so to say. So person will check your kidneys and as person we check the other functions of the other. You have your liver functioning test, your kidney functioning test, we have the lung test, we have several tests. You just scan, you be a natural health and wellness clinic. And hunti, and a year boss ham common, and hunti na year two, your viewers for no. Seniors also super so you see, we are entering Christmas in the next 2 weeks near do Christmas. And the radio show I was listening to a conversation concerning be a winner stroke. And you see, when we are getting to Christmas, now when you stroke, now stroke ni bubu to painfully, no. Just imagine, how are people's approach to you? Now, if you have a stroke, you might be rich, but people will not have that time for you like you think they should have. And I need an ABB, a command banasa. My young Christmas, Muna and Conco abusing Yamibia, Abema, after baby Christmas, no. Not Yarabi, Ababa. You don't know how what next year will bring for you. Some commono and Yababo. Near to your home for near whom and a more a bit too. Near there, then, yet they in the couple of weeks before Christmas, no, Hot Talk Show, we are bringing something we call a healthy Christmas. Every day, no, we'll be giving advice on some of the things we should do, and I'm also to the near yedi and dry no. You know, the fact said you are in a bush during Christmas, no, and then she say, "Oh, could know your condition and then know the step to take." Bibi chiwadran over the Christmas festive season no rana child and one can you see ye bie de bia anti the hian say obefre ya na mes no then waba ne hu de betumi aye as a clinic there boy. We have an emergency hub as well. You just call us. Bibi or Ubia, and if you need to get one of our personnel, come around to attend to you now. We have the Royal Health Outreach team. They are on standby, ready to be with you. We are so well organized, so well prepared for you are a viewer, and then any other person behind you would even recommend us to. So don't hesitate. You born them come on, but before no young concoji your boy for crash or chasing kind of city gold at my home color. Christmas about to be beach wadofo. You understand? You have a loved one. I feel someone has been so wonderful to you. I feel somebody has been so nice to you. You would want to say thank you. Sikani de be a wound be, but be a nice bracelet be, a nice chain be. You know something. One interesting thing I'm more city gold is yet me true din kraguso. Just imagine so walk on up me din the jewel. Near quack true jewel. Nice one bracelet be. Last me kwa sure na ma bomb me dear fine. Your friend me kweku. Na me de kweku na top me suit me. It looks so nice. Oko city gold. Just get there and tell them so. Who share with TV so you want to get that thing done for a friend, for yourself. Kono mo ya ba akoma. Na also bro nye Bobby. We show of kaftan papa be now they are boss so nice one. It's nice. Now what show chain be now you know it makes you look very great. It's no city go the more color shopping more. Just go to Mokola and then just go get it. And now Royal Natural Health and Wellness Clinic. And Royal Natural Health and Wellness Clinic people hear Royal Natural Health and Wellness Clinic and think say I war ejuman kwani here. And yeah, we are clinical ye BPP yarabe. The answer be two and a mono by a show homo. Yarabe a yo biano. And I wanted the Yami Adom and Yami Eddie Achen. I'm so happy. People come all the way from the States. People are coming from Canada. People are Christmas Eve. Interestingly, the people that are coming to Ghana, no, I would say a lot of them have called, so or they are coming. They watched our October show online and they want to come and see us. I'm so happy. Oti Ghana untu anamonye. Run natural health and wellness clinic. Omo abeka na pass post office. Sina meka and Christmas na ye adwuma. Me wo ho. Dr. Deborah wo ho. Dr. Clement wo ho. We have other doctors that come on local basis. Oba each day bia and you're going to meet somebody there. Just to anamo brana yen hwe de betumi ade ye be ye edi abo. Enya awo person na meka no. Say infection no. Say any chronic complication bia. And I'm poking komo aye boy kwampo no. Utumi de ba ho na ye hwe na hu advice ye de be ma wo ye way wo ho ye too painful for ye bibi piara just call us, just walk in, then let's see what we going to give to you. Yankoji omankra to eba and then come on say we are looking at reoccurring infections and then what you should do. It's important and then why you should take that step. Yankocha your own braces here. Ene wahunya Yamamu Akwa Baba Rural Natural Health and Wellness Clinic. Session Yamunim Rural Natural Health and Wellness Clinic has been in session for quite a number of years now. TMPC, am I a license? We are operating as an alternative medical center. So BBA, AOBA, say a woman, say a infection, say then a year, say be a yaro. Na opese oba ayaresabia na ehwe no Rural Natural Health and Wellness Clinic your comprehensive lab ewa ha se bibia ye obi a doctor asio anase woko bibi mpuni aka chose Corona Medicals empo ebra no utumi ba Rural Natural Health and Wellness Clinic ya so ha ebeba berane yo bibi sunkron ha e friend colon hydrotherapy se bia tete no na yesta esa anase tete no se bibi ye wa aka chose obi a yen mix niama ni yemfa ensaw sa niama ni nyina ye won abefo kwan so Rural Natural Health and Wellness Clinic ha mo se bia wapon anase wakọ adwuma waye adwuma na wo ho hensha dan fe nye de bia na wo se bia wo se wo da eduro so bi na nanka ohia massage kakra anase bia woni doctor bonko na se wo diet anase exercise bi mpo na o chiro na nka okọ mu a enka be den ebe ma wo ho ato no etumi agina wo ho na mu so biem na wo ho ayeden na nyina no ba Rural Natural Health and Wellness Clinic ayo a doctor for her omo ne mo be bonko mo bɛkyerɛkyerɛ kwan a ɛwɔ sɛ wofa so nneɛma ɛwɔ sɛ wonyɛ nneɛma ɛwɔ sɛ wonyɛ sɛ mo pɛ awɔ mpo na kwan a ɛwɔ sɛ mofa so na mo awɔ no ɛbɛbɛ mu sɛ bia yɛbɛtwa scan sɛ yɛbɛ ɔbaa anaasɛ ɔbɛrima mpo yɛbɛwura ne scan ahwɛ sɛ o prostate anaasɛ sɛ biribi mpo o testicle anaasɛ biribi ɛɛtɔ kyima mpo even the abdominal scan biara na yɛakyerɛw sɛ kɔkɔwura ne bia na wokɔ akɔyɛ health insurance anaa mpo sɛ okwa korane test bi ne yesi of scan kan no oba run natural health and wellness clinic a yetwa sa scan ni bi wa ha oba ye betumi adan etwa sa scan na ma ye wo health professionals wa ha omo akwadara wo omodwuma omo ye ne mu ye wo pharmacy so a oba pharmacy nduru bi a ehu hia se wo se woto se bi a yasoma se brabeto ana se wabampo na doctor na prescribe bi ama on ye nduru ni nyina no FDA ahwehwe mu a eye mapa a wotumi adan ekọ pharmacy ekokoto now you're the onom na oho eto bibia hia obi a bibia ekire adwum bia Rural Natural Health and Wellness Clinic no ye wo Abeka La Paz Post Office bibia ofi ba bia no fa car na catched mate ni say obesi wo Abeka Post Office udu Abeka Post Office a obo Rural Natural Health and Wellness Clinic ye signboard kes here green and white building mu just walk in then how only Rural Natural Health and Wellness Clinic and bonkomo Rural Natural Health and Wellness Clinic ye say wa pomoden and it will for a science so Emma Akwaba Kesepamba Royal Health Talk Show. So yeah, before we went on break, the discussion I said over the past weeks, over the past month, we've been looking at what causes the kidney infection and now what causes the kidney to be affected and now what causes the kidney to have a problem. We've looked at several factors. I think for the first 2 weeks that we did, I think the first 2 weeks, we had it with Dr. Clemenda, we looked at urinary tract infections. We looked at prostate infections, we looked at prostate disorders, and then we looked at the pelvic inflammatory diseases as well in ladies. And I think we looked at bladder infections as well. These are things that they all sum up, they all lead to, they lead or they have a direct relation with the kidneys. And to say, ye didi, say, ye boabo, ye living lifestyle, say, ye num. And I say bibi aye adokodoko de that is how we say it. And asumpo no sex life your lifestyle bibi aye ye bia no even sometimes the entire ye shempo no they play a role in our kidneys getting infected. Ye didi definitely no there is going to be some signs because when food is taken in it takes a process. And then the various organs and the various this thing picks whatever they need. The residues are gone, goes to the kidneys, they get processed, the kidneys and then the liver, they get processed, and then the rest comes to the bladder and then they come out as urine. And now they go through the large intestine, that is the colon, pass through the rectum, come out as feces. So any of these two, they give you a sign or they give an indication. Ojun soseni ojun sote. Ojun soseni otumikra ojun sofa. Would give you an idea of what is happening within you. And one of the major things we looked at, if you can listen to the conversation now, infection, which means primarily no BBPR no infection no and a start here. Now you ignore na air travel, and the bladder is directly linked to the kidneys. To the moment the bladder gets affected, the next thing is that when it's spreading, it goes straight to the kidneys, and then it begins to manifest. Then you have to be placed on dialysis. Then you have to go through all the process, and then you join the masses in the talk that is going on in dialysis. The discussion we are having now is just to make sure we are okay. We notice something that is happening. We take steps so that we don't get to that place. Say yen duho. And no hunting a yebo sankomwe. Like I said, on this show, I'm always grateful to Home Base TV for giving us this chance. So we come not to market, say, a drawaway and our no ma, a bebuama wunya kidney, dabi, and yes, I near bewa. Ye suya de. Intino, Dr. Clement by no or sharing the various types of urine. Urine color is supposed to be amber, light amber. Say yellowish color no. A yellow light kakra. That is how urine should be. When we say urine you're whiter and now plainer, people think say that is the normal one. Also no, it could indicate say maybe there is diabetes. And now you are what hydrated. Be ensure that one no ensure enough. And now say be na diabetes a man body sir. Urine and now juice or color air cloudier. It indicates that maybe there's hepatitis B, there's a liver condition, or there's something going on. Urine air very darker. Be another there's a black leakage. Be another there's a problem going on somewhere. Be another the kidneys are infected already. And as suppose there's something that is happening. That is why the urine color has changed. And so we looked at various forms of urine and then the colors that are involved. And then Dr. Clement made us understand, say, if you are going through any of those things now, you should know, say, also 9 years in Sabia. Christmas, there's going to be Christmas breaks. People are going to be at home. You know. I encourage you. You see, right Natural Health and Wellness Clinic, you see Christmas where you dream. Yeah, you will dream to an amombra. Yeah, now, first program here, went to me about my old dear. What to me about ya tete so fine. Christmas, ya tete prices, so oh, yeah, urine test now. It's very cheap. It's very, very cheap. People come and like, oh, sir. Interestingly, no, the lab people say they be people like Francis because it's so cheap. We've reduced it so that you can do it and then know what is happening to you. So just come around, get a urine container, give us your urine. Let us do the urine RE for you. Find out if there's any problem, then we know what to do. To be one share previous show, not to make Facebook, and also to make X, and now formerly Twitter, to make share, home based TV GHR. You can watch the previous shows and then maybe you can also look at how some of the things were. Now you can go to our Natural Health and Wellness Clinic page or Facebook. Now I can follow you. I'm sure you see all those interviews in and so that you can as well listen through and then see what you can do as well to yourself. What go through that? Dr. Clement made us also understand that there is pains, periodic pains. Your bar, now I ask you, yeah. Check here, yes, you, and yes, she. Check here, see a PID. Sometimes sex is supposed to be enjoyed, but on sex pains. It is not about, sorry to say, it's not about the size of the manhood, but it's just pains that you're experiencing. Sometimes even after sexual intercourse, you feel some burning sensation, as if say your husband or the mekona or this burn or no that you feel the pains and all those things. We or banner will go through that now. You should also have yourself checked. You understand? Your menses become very disorderly, and they're about 3rd next month. Now about 28. Sometimes even within that month, which you menstruate twice. These are all signs. These are things telling you that there's a problem down there. And when there's a problem down there, now like I said, they are all linked to the bladder, and the bladder is directly linked to the kidneys. Oh yeah, Bema, be our quack or Junso. Now Junson, won't call the old chim and son, what Junso, but Junso there can do what now. It's supposed to flow, but oh dear, Okochima, what you say we cramp on our Kakotina, Felicia Johnson, a be akin, no quack prostrate test, Oko say and your prostrate in a yo. You are wondering what is happening. Oh yeah, Bema, be our Felicia, oh Junso, out to your womb. Until, like I said the last time, Obama the audience or not, say your pet, but no hospital, Pacho, Emsa Minyagono, ya gono. Yes, a negative. Into a negative into no office, and then near me, more prostrate, mam, Namishe, yeah, prostrate, so she knew homo. Then they are forgetting, say there's a bladder infection, there's something called urinary tract infection. Not you really feeling now. So we advised. So when you are going through this pain and you are going through all these things now, a bone cocoa, and I say a bone kai say, be a nappy air coso, even frequent urination. Oh, Felicia, in Sona, no me antinama, made you so be brain. Dr. Clement made us understand that one means sure it goes through a procedure. Sometimes it lasts up to like 4 hours and Sana Johnson Ado. But the only means sure na indeed 10 minutes in Puna Oko Johnson. To that, Kakra no asro no Oko Johnson, no aba, Kakra no asro no Oko Johnson, no aba, no asro no Oko Johnson, no aba. These are all indications, these are all things telling you and then feeling thirsty easily. Wo no means sure and chewona is come in the beam. No asanso akwa no means sure, no asanso akwa no means sure. It is good to drink enough water, but there could be something going on. BB air koso, and it's now all these signs. No, To all these signs as an individual, also two animal. To be a making, will be our yes, we won't signs when you now. Into only no two animal by a resabia. Or by any doctors at Nase, a share the ecosu. Because opium, but when your urinary tract infection be, oh, when your pelvic inflammatory disease be, oh, when you're railway and as when you're, let me say, in all general conditions, there are no an underlying medical condition be. To doctors, you and is that the moment found to a druso for 14 days. Normally, it's an antibiotics, you know, and what or so for 14 days. Or call a conum drain. Onum we are, I are Sabia near said, then and a see. Normally, a typical Ghanaian man would go take the drugs first day, second day, third day, say, me what to me? My fine. Tibona will discontinue a drone. I feel all no drone bien. Now we live your life. Into while people there also, doctor say me to the action, I mean no drone. I force bona on the end to me the full 14 days course no. To anu me wie. Onu wie no. Doctor ka say uwie brana yen hwe the course na yehu anomo a bitu. But all no we say no aton but umiani ni numedro ni wie enti no feel say me okay. Me okay. Me ho atom enti no me nkohu doctor ni biem. Wa be 2 month time. Bona de na year no de kwa ya sabia no. Na assign so I start to say then. I started manifest. I feel na Johnson no. I started to say or Johnson 10 biem. After I started to tell you during urination. Or your bar started burning sensation no. The menses now started about 2 times in a month beam. I started to on the beam. I say, so then I am 3 months ago. I'm going to do it. I'm no me. I'm a home to me. I feel there now. As I saw, I say, baby, and a drone and me. And when it happens that way, when we are quite in near me, no, aha, doctor, a drawing or the mammy, a drone crown, the first stage scenario person. The drone and Santin decided my men born on Trasuna, mention the ABC. Tinende, Senna doctor, this menum 2, intiminum 2, and upon a minum 2 in gray. Following day, na menum 2, no, next science, remaining course, no, me hotom intimate Charles, and decided my main charge from where I go to. Don't know I start to say, oh no. Oh no, Nampa, no more sense what Tony be. Then the woman say, oh, a drain a Jamie. That is great. Tinende na okoso aba but asa na no akwa akoto be 3b e dey account no dey baba beto tinende omu se ade ne start se eba na pa akwa akofe bi no ehwe no anom no oko ti afi obedu baby no eye obi ma onu eduro na ohun results bi ti first na doctor say num 2 afi num 2 no ohun results then say dey na mama ni en 4 na wa en 4 or yeah for no results kakra. It's not say oh my main so. It's not after I started we moving from 2 to 4 because on 2 no engine beam to starting no 4. And then this is where the line begins to get drawn. This is where then the kidneys now begin to sit up and say, hey, you see when you go me so the pressure is now coming more. Now the body begins to develop some resistance be. So I feel me drone crying Joe. I feel things are beginning to happen. Now today we are going to look at one. What caused the infection to come back again? Then after we look at the complications of you abusing the medication. Then now we will link it to the kidneys. So this is the quick thing we are come to do today. And then after we open the phone lines for you to call. Ask your questions and then we try to answer them for you. So one, what made the infection come back again? Debia yakasa ye tufo say young friend say any sexually transmitted infection. I'm a married man. Timene meyere any she muna infection ne bae. Bia wo de won worry about oni mu ho ka fo oni e share ye ma infection ne bae. Timu share na infection ne bae no. Won ka funa ko hospital. Doctor, e share no say oh, a infection. Die draw we nom ye nhwe se ohun beto wa na. ampa wagye eduro no onom ti onom no no ho ato no wo partner na wo nene na ewo ho no wo anum eduro ni bi. That is the number one signal. Bia na a urinary tract infection na onyaye. Into a compound house na mote. That is where the problem is. Yet the compound house na makwa konya urinary tract infection. And na makwa toilet wo compound house no washroom wo. Na minya infection wo. Minya infection na makwa hospital. Doctor mama do mama no. My back, may you see the same washroom na. Nipa na bia okokonya na ode bae no. Onu ntreat no ho ye. Eja, untumi nton wo yare so yes first wo ton yare na onya ho aduro. Mana nse wo ton yare na eja ye ka ho nsem. Nti no microphone po suro so mbeton mo yare no. Ti bi onya infection no, wan po obi amane na onu atreat no. Ti o treat no ho no. Nipa na bia onu wo infection no. Bia no a typical Ghanaian guy oba feel so onya for thought bia no onuma o de betumi dey treat no to avoid the thought or strong white blood cells the immune system no more do fine nti no born for thought bia no call the six thought bi no why fine nti no okoso a you see washroom no wo de one nom ensa ni bi one ko she bitters ni bi enkafoka ofe odudu eko nti no oda so you see the same washroom with the person ube una infection ide assign so ababiem because maybe one your partner or the people around the community refused to also treat themselves, and then you the individual that got infected no you are having a low white blood cells or a lower immune system. With immune system no enye strong and e betumi ama yare na ide assign so about subim because your partner or the person you are sharing that washroom with refused to treat him or herself. And that is the number one thing that will cause the reoccurrence of an infection. Yeah. When you have an underlying medical condition, my friends say be more diabetes, more hypertension, more ulcer. I have an H. pylori infection. And I may no medrobi. No, I have to be on the medication for a particular period of time. You get to some time like Charlie, my bread to hell with these drugs. Let me switch to something small and live life small. You also stand a chance of getting that reoccurring of an infection. Just imagine say hypertension and answer diabetes. Nowadays drugs no way jai no. Na attack na ba. You understand? There was a chronic condition and then an acute one has come again. One show 1 year, be an stroke, and never be at all. One show year, be an infection, your kidneys no, and never be infected. That is why we advise say, be not to mean turn area because of where you find yourself. But make sure say you get a good immune booster. You see, immune boosters be bria bakroma year ton. But make sure so ubenya there papa. I bet me abo who buy ampara. Ubaru Natural Health and Wellness Clinic. We can run a full blood count for you. Look at your white blood cells, look at the red blood cells, look at the platelets, and then see at the saying a cost saying a drop brain or say the mouth, your boy, you recommend the mouth to me no. To be a whole shame. Come on, ye boy, unqua infection, a qua na ba. It's reoccurring. A drone one sa ma kwa ya pa bampo. Obu okwampo afi on the pharmacist na be ya damfo. Ti okompo a ombo ne yare no so. Odu wa na pharmacist no akọ shelter no so na wakwa akoyi na odi ama no. Because onim say e condition ya na odi baby. And this is how far some people have gotten to. I like the way you are sending your messages. Keep sending them. When we get to the stage that we need to discuss them now, we will look at it and then discuss them as well. And like I said, when you keep taking the medication, my friend say an infection, Into call doctors no ye ma antibiotics or jikokonom, both a herbal antibiotics or an orthodox antibiotics. It dem all say jikokonom. No we are 14 days time bra. Na yen hwe the man buy. No on 10 days no so we discontinue the medication and onum we no feel so me ho atomi afi na me call hospital bi mo ka kwa consultation bi na nurse bi aba be fichi na anima show star bi ni adenti no chale onim me nko me ho atomi ye da nyame ase ye de nkan be mpaibo na eja wabọ mpa da nyame ase se no ho ato no wankọ nkohu doctor ni bi wankọ hospital ho bi na afi onama na yare na science why de abibiem and the don't can a kind of quack no at your you get to a stage that your your body will develop a resistance towards that medication. Therefore, say antibiotics na first, one kakra na agile. Now why fine now when should be after onuma na still now yare. Onuma still now yare. Onuma still now yare. No, because I had then so. Doctor no. No, treat you no. He had a reason for asking you to come back. Yeah, na ya no what to you no. What feel say e come. And so you na we into us here. Think after that 2 weeks no call back to doctor no wa. Obe hu with me advice so be a to ask for 1 week extra. And now suppose so yen hwe yen ma ye ho a day or two. Yen ma ho some time. Na yen hwe say e ho be hia say obetue edro no so na sempo no yeah, massa, immune boosters be about Buama a 2 year and I say crana out immune boosters now bone by. Send a yarn into me the MBB. Send a wound to me and coswanum that particular medication. And nothing a doctor near the advice you to be on to come back. No. And because of lying, I'll be quite dim. Because of consultation, I'll be quite to Antino. Right National Health and Wellness Clinic, there one interesting thing is when you pay the when you pay and then you pay for consultation with a particular conditioner. Your next visit, if it's a follow-up on that conditioner, you are not asked to pay anything for consultation. We just continue from where you've gotten to know. And you just call them now, and that is what makes us nice. So we are like a big family. Obi owa we back clinic home, and today we had a patient oba ya. Also oba be review because afina so na de bia ye kan TV so afiso a oba na ono kwa ba am say oh na ma oyira amba also oh doc ye ba be hu later. Obana wu, we're like, wow, yedanyamiase. But then, and that is the joy we have as a family. That you see, and we always tell you on TV, wow, we share on TV, say, man, if you think he said there is no solution for you, because obi sometimes when people call like, me chi heba for ya and my brain point mo kase on TV so I share mo keke, yem pesi eba. Make sure there are difference, bruh. Na yen hwe de ye you see what we have patients who come to the clinic omo pa na ye hwe na like oh doc the way I'm make us say fa then am refer me na say you refer because our condition is beyond us yen ka say because ye clinic nti chinya ni chi no ye no oba na hu be hia say refer wa ye be refer to a facility a omo so take over we are linked to so many clinics it's no bad. Say Dr. Deborah Dr. Deborah has other clinical she's affiliated to. She will link you. Say me, I have clinics I'm going to refer you to because I'm also affiliated to them. Obi Free also committee 22. The way I know people no own to member. I showed him your ba me share the clinical uncle. Or call you know. Near your guys oh madam, yes, say also Dr. Joe or see me brand be. And interestingly, they call you like, oh, no more to us. Until man, it was say Musi den hu say e do because e do we are no de maami ani herbal medicine there o baby a oba say no also otua so a eno ani e be mo atua so when you have that link and rapport that's an emergency. That's what I was telling you say when you call and we need to refer you now we will refer you nicely and when you go we know how to communicate with them we know how to lace your information to them for them to continue wonderfully from wherever we've gotten to and you know men tinefie and dream say Oba Miaju Sikakeke. Dabi. Oba Royal. Those who have been there. One day we'll do a testimony time and then one thing we don't like is advertising, branding and Dabi. We want our people to speak on our behalf. And for some time now, most of the patients that comes to clinic are referral cases. Like I'm saying, a couple that came for Christmas, Christmas, and they came out of a referral from another couple who are in the state. We didn't even your picture of the chair said, Doctor, only Papa say, oh yeah, minimum no. Opa last year, no say, I know your name. Almost say, when our boy, anything as you have your bag, and you perceive, we should come off. But we'll see, or Baba be we and son will come off no. Into our Baba share the procedure also of fun one son. We took him to the product. I know, I know, Miss Yanos. Look, $1, and I say, $1. All we need to do the forex as you know, so me start this year. Kita cities, but me start it. And that is how we want it to be. That is how we want it to be. What Ghana? What Kaswa? What's your Bekawa Mount? To member. So if it takes us up down for medical treatment, Obe Chemumpo, Akonof, Waba Clinic. Intimate if you think say all hope is lost. Darby. Chuanomo 2024. Also, we put the other way news say also person you are from ma. Next year Mother's Day no. At least say on we yampona. Also carry be a say eh yedanyame ase. Chuanomo Royal Natural Health and Wellness Clinic. As for fertility in there, we are known for that. We are trying to have these discussions so that people will know say Royal ye treaty bibia go for pina oba clinic obi awo to the extent say we are fortunate to say it's a herbal clinic by a way now. Honey, they've given us a chance to do way. We say our people now refer us nearby say Omicron Royal and a Royal Force Yembra has say and they among come back and they've given us midwives who are taking care of our children or more they are taking care of them every Mondays. And it's so wonderful. So we see the progress even of the children that have Nyankopon afa yensa so omo weighing onto you and we have a wonderful time. We have a wonderful time. You betcha your mwakwa koje yaboa phone krato. You back quickly. I just wanted to look at Royal Natural Health and Wellness Clinic and then come back again to the studio. Then we open the phone lines, we read the messages that we've had and then we continue. Tiencha your koje yaboa phone krato mbrasisi here. Yamamu akwa baba Royal Natural Health and Wellness Clinic. Session Yamunim Royal Natural Health and Wellness Clinic has been in session for quite a number of years now. TMPC, am I a license? We are operating as an alternative medical center. So BBA, AOBA, say a womu, say a infection, say then a yo, say be a yaro. Na opese oba ayaresabia na ehwe no Royal Natural Health and Wellness Clinic your comprehensive lab ewa ha say bibia ye obi a doctor asio anase woko bebi mpuni aka chose Corona Medicals empo ebra na utumi ba Royal Natural Health and Wellness Clinic ya so ha ebeba berane yo bibi sunkron ha your friend colon hydrotherapy say bia tete no na yesta esa anase tete no say bibi ye wa aka chose obi a yen mixing niama ni yemfa ensaw sa niama ni nyina ne won abefo kwan so Royal Natural Health and Wellness Clinic ha mo say bia wapon anase wako adwuma waye adwuma na wo ho hensha dan fe nye de bia na wo se bia wo se wo da edro so bi na nanka ohia massage kakra anase bia woni doctor bonko na se wo diet anase exercise bi mpo na o kire na nka okọ mu a enka be den ebe ma wo ho acho no wetumi agina wo ho na mo so biem na wo ho ayeden ne nyina no ba Royal Natural Health and Wellness Clinic ayo a doctor for ha o mo ne mo be bonko mo be chire kwan ya e wo se wo fa so nyame wo se wonye nyame wo se wonye se mo pe awompo na kwan ya wo se mo fa so na ma wo no ebebem se bia ye betwa scan se be oba anaso be mampo ye be run scan actually say o prostate anaso say bibimpo o testicle anaso bibi touch mampo even the abdominal scan bia na ya chire se kokorane bia na o kwa health insurance anampo say o kwa korane test bi ni esi of scan kan no oba Royal Natural Health and Wellness Clinic yi twa sa scan ni bi wa ha oba ye betumi adan e twa sa scan na ma ye wo health professionals wa ha omo akwadra wo omodwuma omo ye nimu ye wo pharmacy so a oba pharmacy ndru bi a ehu hia se wo se woto se bia ya suma se brabeto ananse wabampo na doctor na prescribe ama on ye ndru ni nyina no FDA ahwehwemu a eye mapa a wotumi adan ekọ pharmacy ekokoto now you're the onom na oho eto bibi bia hia obi bibi bia ekire wadwum bia Rural Natural Health and Wellness Clinic no ye wo Abeka La Paz Post Office bibi bia ofi ba bia no fa car na catch mate ni say obesi wo Abeka Post Office udu Abeka Post Office a obo Rural Natural Health and Wellness Clinic ye signboard kes here green and white building mu just walk in then how only Rural Natural Health and Wellness Clinic and bonkomo Rural Natural Health and Wellness Clinic ye say wa pomoden ene wo hunya. We are actually for so Emma Akwaba Kesepamba Rural Health Talk Show. So, yeah, says in between 7 and 8 p.m. Biano, we have this discussion. We are not afina we tuning in. Yeah, try and come on also. And we are looking at kidneys infections. And like we've stated in our previous discussions, and then we've always been saying, you know, kidneys near say ba na pum ayo dabi. A startifi baby. And nam kwine biso. If started a ball won't carry empo, I will jun so mu. I was sure to say we physics mu. I will lifestyle pattern be mu. But ubu when go so over time, no, like the normal slogan we say as Ghanaians, you be treaty and you know na or no bibi thinking so they treaty. And now unfortunately no, I don't know. I could pain the kidneys no. I feel Nancy Monday, Tuesdays Mondays, Wednesdays and Fridays we have to take you to the renal center to go and do dialysis for you. You see your increases can and you are complaining. And people are asking say eba ni saying eh ni hu eh yare hu benyi. You see yare na eba bon kaye. E show ojunso kala ni sesan ye. Na o feel say o enye hwe. O start say na ojunso 10 o feel say enye hwe. O start say o tia o say ojunso a na o feel say enye hwe. O your ba o menstrual cycle start say sesan o feel say enye hwe. O ti say o tia obi e wase na o feel say enye hwe. So to say onu hu kafu hia na o wi a o feel say won ye okay na o feel say enye hwe. Afi we do stage bia o call hospital you say eh adena aye o kidney o say kidney dey si dey ndu ho na ebo won kaye ebo kokko edu baby na call baby eno nkomo na yatua so and then you hwe reoccurring of an infection if enyama me kan na bia wo dey dey start here no utumi call hospital ko to eduro e na onom ye na call from e na papa asan so ababiem na wo call hospital na wo kokko gi eduro na onom biem afi aba biem na wo so eduro we na de ma me no now start to say oh wow to eduro no. So you are self-abusing, you are self-medicating yourself. In the process, no, your body has developed a resistance towards the medication. Until now, wow, to say, first, na me num two. First, na me num cap we have. You see 30 ml, you see 60 ml. You see, I'm num 30 ml na and Jimmy Beam. To go no man was so no more pie go cap ni mu. Now we're born grand. You really say herbal medicine na send the kidney. Natural, and herbal medicine no. When I abusing medication no. One fan is senior doctor and car say fan no. One num senior doctor and can. And now for doctor and car say unum we are bra. Na me hwe de ekoso no. One yan is sa. Na wa self medicate sa. Na kwa fan nsunsu anso abre no. San komone na ndeye ebo. 0501484671 0501484671 bia komo aye boy oh, nyanka also be free nyanka obe kire wadwen message ni bia ba I'll quickly read some of the messages no and whilst you also wait on your calls into 0501484671 wait to me bro see is it crucial okay so mpacho if you are it's always advisable let me put it this way it's always advisable what are the causes okay so I'll read on the causes as well that the crucial aspect of the we have hello Hello. Okay. All right. So you can also call 0501-484-671. 0501-484-671. Super to me. Okay, I did not complete a medication. Does it have any effect on me? Okay, so let me look at the crucial aspect of it, and then after we pick it. Please, anytime online is okay. I want to read this. We have okay. Hello.
Hello.
Yeah. Good evening.
Good evening.
But your Udini baby or Frefi? Okay, but you're at you. Hello. Okay, but your offer won't see me directly. Men TV so it delays. There's a little delay between the live and then the TV. You know, offer listen to me directly, okay? Hello, good evening. But your baby or Frefi?
Good evening, Doctor. I'm Pastor. What is saying?
Bacho me who you?
Your friend is playing songs near General Manager, plus 1, 2, 3, or Tramodin Sunday.
Okay, sir.
Lena, last week, the first caller, the catcher was there, the condom, drew the negative idea, and mammy implications the way.
Yeah.
Okay.
Bacho me kai open.
What's that program to see Anna voice and low crying in the phone to one of the workers on Anna?
Oh, that's great.
The voice in your group.
That's great.
You see, me regular caller. They kind of to 1 hour before over. Home base in India, but last week, I mean, who about 5 for Anna, to one of my train. Because, what church and room, we could get at 5 o'clock. Matala was having doing sorry. Oh, I mean, because. Yadia nika yari nina doctor. Lack of knowledge. Because my boy was 5 months in me. Me the kind of rosa, no makoya lab, but no nyakoya koji lab test no. It's my turn from August. My turn rosa the thing last 2 weeks. And son of the koya lab no. Almost say negative. Me a lab very 4 negative. Doctor nika ten so member no one so share. None for 4 days. And the uncle and no to hospital. Ya me lab. I'm a mechanic and I for sending for scan. You can extremo. Obiara and what you do beer. One call royal clinic or say at the couple's office. Oh, because say a doctor. What church you because you saw the very last week okay. Obiara was so capable on the ball name. Koto back nami. Koto nde give it your extra. Obi koto extra. Now I can't go home for. When you say me live on the kidney or say no. Doctor, we see program we. Me bomb pay say health ministry. Everything has some effect. Because.
Oh, okay. I think we've missed the caller. You see. Obi awa go through, you see, that is the thing. Obi awa go through no, or explaining no who you might think so kasa bebre, but ye or no like all kind. He's been through it and then he's saying it. Be na wo share no, o feel say it is just like that keke. But say kidney infection and to ebusu ni be na say to obi obenwa, you might think say ye kasa keke. And a bar, it's expensive to manage it. And ye cheap sir, you know. We are giving the advice. Also, wait to me after 0501-484-671. Now, wait to me actually what you be like I said, we have a caller. Hello.
Hello.
Yes.
Good evening.
Good evening, sir. But you didn't baby or free.
Nana.
Okay, Nana. But you at you.
That's sorry. I have a Philippines room.
Okay. Okay. Okay, but I started yache. Okay, you know, me the minimum bet to her own. After the show, no, right? You trust scan wo. To me, ba me trust scan. Near she say then, and I Emma ne basa. Say who be here? Bossy be other tester. Near to me, aye. Near who the best solution and be more. Why? You know, after the show, no, they are coswasa wo she me the minimum bet to grant no. Me number to do na wa frena. You who the bet to me aye e dia wo. Why? Okay, so someone was asking for medication or like I said online. Somebody was asking say online or like he read it online about the condition. You see, one interesting thing about online treatment and then they say would say me feel royal maba amede me na ma to ho. Na wa friend here bon komo a difference say bia uti o ya no akọ online no akọ so what are the causes of headache? Sometimes no nyama e de be ma ho no e be ma condition bia wan hwa na enye no na eyo. So it's always advisable obu medication for treating headache. Bia na wo headache no enye stress. Bia wo medication no you are having a low HP. Wo moja na wo form. Until won't call hospital now. You might not know, and also if you've not spoken to a health professional now, you might not know what is wrong with you. So it's not like we are against you going online to read, because I'm online. I'm also wishing that people will come online to talk to me. I'm on Facebook, I'm on social media, Twitter, all those. I'm there. Until definitely know when you type in something on my page, Philip and his team can respond to you. If I'm the one online, I can respond to you. But be a now. What we might say in Kauba clinic near Chin Moja Kakra, Oba ni examine on Kakra, Oba ni do Gina machine Sudia, Quebec me a solution now. Into the moment, if you're only sticking online, we have a caller. Hello.
Hello.
Yes, good evening, but you didn't baby afraid of you.
Oh, me tell me, yeah, tell me, I got the meeting at
Okay, Dimacho Yetio.
Me tell also no.
Ulcer. Okay. She said ulcer na yawa Uber Royal ulcer we do an H pylori test and now post an abdominal scan. Nti abdominal scan and now say H pylori test na ni hu. Sometimes the abdominal scan will let us know. Say ulcer ewe hin ewe intestines ni mu ewe yefunu ni mu and now say hin side na wo ni hu edura e betum dey treat you. Oh, or from say ulcer we have different types of ulcers. We have the location next year. We have the wo yefunu, you the wo insunu mu. Inti no oba na be hu. Sometimes it could be impossible anya ulcer. It may be a different condition. Na man na feel it say ulcer no. Oba ye be hu, ni hu say na dey e be treat ama. Inti ment na fie enka say ulcer, inti no wa bia wa over the counter. Wa kwa to edru. Uto edru na onom ye na pe na bia it gives a condition, and then you might be wondering so anytime you are going through any condition try as much as possible to make sure say when I that is what we always advocate, and that is the reason we are having this show. The primary reason for this show is to make sure say at all. My name is Edda Screen. Is to me after me 023 1150340 023 1150340 and as 027778 5902 027778 5902. Any of those numbers you can call. The other numbers are also projected on the screen. You can call any of those numbers at any time. Just let us know what is wrong with you. We are a clinic. We are there for you. We want it and a year show way. You understand? I'm happy with the response we get after the show. Like I said, yeah, must a beton withdraw. We don't come to sell medication. We come to teach. And it gives you an idea of what is happening. We know the solution. Because what wait here the no. Now we couldn't read enough of the message because Yemre no call. That's and then we are going to take time. Like I said, from next week we are going to do Christmas. Healthy Christmas, and then preparing for 2024. And more I bet to me. Like I stated, bro, parties not start you. Parties not starting. Programs not starting. The stress is coming. Don't stress yourself if you have to, if you have any medical condition. Se bibi na ekoso na won eche wadwen your numbers na that screen so no. Utumi free any of the numbers. We are ready over the Christmas festive seasons no. Rather Charles and Wellness Clinic, we are going to be open 24/7. Yes, we are going to be there. We now even work on Sundays as well. Today here and say, Obe free. Which one among you are cut the pass post office. Brad, you the ekoso. Like I said, well, they are one and coffee face say, but and ya won kwan ye BBBA do. Brand bonkomo bronye, there are special Christmas packages. We are still doing the urine test promo. Just come around, give us your urine. Let us see what is going on. Yen one more a bit to me to Eddie Aboa. Near who solution say a mouth. Maintain if you think there is no solution to your condition. There are several solutions. to an ammonia who the bed and you between the best solution for you. As I can say, the entire crew that helped me to Akoto, and from the MCL to Tio, my director, to Efo, that's Gideon, my boss, and then the entire Natural Health and Wellness crew that helped me, to Philip, to Abigail, and then to Regina, and the entire crew that helped. That's a neighbor share bongo. Me din amidiso Joel Ida Nesel. Merry Christmas.